Well, good afternoon to everybody, and welcome to the AgrAbility webinar series. Today's topic is suicide awareness, and our focus today is going to be on veterans and rural Americans. Before we get started with the actual presentation, I just have a couple of quick webinar instructions for you. Obviously, we do need speakers or headphones in order to hear the presentation, as we do not have a phone connection today. If you're having any problems with your audio, with your sound, you can go to the meeting menu at the top left of your screen and run through the audio setup wizard. That's also useful for those that are hoping to use microphones to ask questions at the end of the presentation. If you do have questions, you have a couple options. You can type those in the chat window on the left side of your screen at any time during the presentation, and we will collect those at the end and have our presenters respond to those during the question and answer period. Also during that time, if you do have a web microphone, you may use the raise hand icon, which is at the top bar on your screen, and just click on that to raise your hand, and we will do our best to enable your microphone. And you may ask your question verbally. At the end of our presentation, we will have 4 quick survey questions. We'd appreciate you sticking around and just spending a couple minutes clicking on those to give us some feedback on your input. We are recording and archiving this session, and the link is on your screen. You may go ahead and click that now if you'd like to open that, just so you could bookmark that page. If you do have any problems in terms of technical issues during the session, please go ahead and type those in the chat window. And if you're not able to use the chat window for some reason, just email us at agrability@agrability.org, and we'll be monitoring that account during the session. Also, I would add, if you have multiple people at your site, it would be helpful for us to know that, and if you could sometime during the session just type that in the chat window to let us know that you have more than one person at your site. That helps us know how many people actually participated in the webinar. A few issues that we know of. If you're having echo problems, that probably means that you're logged into the session twice. So you need to log out for at least one of those logins, and hopefully that'll take care of your problem. We do have 2 remote presenters who are off-site from us here at Purdue. So if there are any issues with being disconnected with them, please just hang on. We will reconnect as soon as possible. And we're thankful that that has not been an issue recently, and hopefully it will not be today. If you are disconnected as a participant for some reason, please just log in again. For those of you who are not familiar with AgrAbility, our program is sponsored by the U.S. Department of Agriculture, and our focus is on helping people involved in agriculture that have some kind of disabling condition. It could be physical, it could be a chronic disease, or it could be a behavioral mental health problem. Every AgrAbility project is a partnership between a land-grant university and at least one disability services organization. We currently have 20 projects around the country covering 22 states, as one of our projects is a regional project, and there are also several affiliate projects that were formerly funded but are not now, but are continuing to provide some services. The National AgrAbility Project supports the state projects, and we are housed here at Purdue University's Breaking New Ground Resource Center. Our partners on this grant include Goodwill of the Finger Lakes, the Arthritis Foundation Heartland Region, the University of Illinois at Urbana-Champaign, and Colorado State University. If you have not yet visited agrability.org, we would encourage you to do so, as we have a wealth of information related to issues of disability in agriculture. Today we have 2 presenters, and both are affiliated in some respect with our partners. Shai Lewis is from the Goodwill of the Finger Lakes in Rochester, New York, and she is the Lifeline Manager for their 211 network. Also, Bob Fetch is from Colorado State University. He is leading some of our efforts in evaluating the impact of AgrAbility projects around the country. So at this point, I'm going to turn things over to Dr. Fetch, and I will come back at the end during our polling session for a question and answer period. And so, Dr. Fetch, if you go ahead and activate your microphone and webcam, I will bow out.
Good afternoon. Welcome all of you to this on-site webinar, and we want you to know that Paul, Shai, Cliff, and I are very pleased to have so many of you participating today. We're really glad to have you join us. There are going to be three parts to today's presentation. I will do the first part, in which I will give an introduction to the overall situation, answer the question, how is suicide a public health problem for those of us who work in agriculture and in rural communities? Then Shai will present what are some strategies to recognize and assist someone who might be at risk of suicide, and then we'll open it up to questions, and we welcome your questions. Well, let's start with farm and ranch stress. In one of the studies that we've looked at, they looked at 130 occupations and identified farming as one of the top 12 high-stress occupations. According to NIOSH, the National Institute for Occupational Safety and Health, farm owners were second only to laborers in the rate of death for stress-related illnesses. And that's out of 130 occupations. So we've known for a number of years that farming and ranching is highly stressful. We now also know that it's very dangerous. Farming and mining are the two most dangerous occupations in the U.S. Well, financial stress and depression are related, and we know that many of our farmers and ranchers and rural community members experience financial stress, and so we ought to watch for their depression levels as well. In a study of 425 students, poverty and unemployment significantly predicted depressive symptoms even after controlling for demographic risk factors. And it's remarkable, I think, that depressive symptoms in childhood predicted adolescent depression, suicide attempts, interpersonal problems, and career dissatisfaction in early adulthood. So depression can be long-lasting and long-term in many of the people in our country. Many farmers and ranchers struggle with depression. It's not really clear whether they experience lower or higher levels of depression and other mental health issues, as does the general population, because the research is mixed on that. Some researchers have found a relationship between exposure to pesticides and high levels of depression among Colorado farmers or ranchers. North Dakota farmers' depression levels were almost twice that of other rural populations in the past. In an Iowa study of farm men, they were more likely to experience depression if within the past year they had, and take a look at this, because you probably have some of the farmers and ranchers you know that have experienced some of these. They had lost something of sentimental value, they experienced substantial income decline, they had gone deeply into debt, they faced legal problems, or they experienced an increase in health problems. If you see those in some of your clients, take note and see if you can spot some signs of depression or possibly suicidal thinking. Unemployed individuals were more likely to experience chronic depression than employed individuals. Participants with no funded health insurance or publicly funded health insurance were more likely to experience chronic episodes than individuals with private insurance. Well, what is the common cold of modern psychology? The common cold of modern psychology is depression. A major depression interferes with our positive experience and dramatically affects our life. This is more than the normal blues that most of us experience at some time or another. Every year, 1 out of 10 Americans experience a major depression. So depression is pretty common. We might say the common cold of modern psychology is depression. Well, what is the best, most effective cure for depression? It's a combination from the research that's been done. It's a combination of taking good care of ourselves, counseling, and medication. If we find ourselves or someone we know is depressed and clinically depressed for a while, it's best if we would refer them to professionals who can listen to what they're talking about, what their situation is, provide them with counseling, and provide them with antidepressant medication. Well, what do you think the leading external causes of death in Colorado ranches and farms have been over the past several years? First is suicide. This is usually surprising to people who haven't been in some of my workshops over the years. Second is large animals, and third is tractor or machinery turnovers. Historically, the leading external cause of death on Colorado farms and ranches has been suicide as the leading external cause, then animal incidents, and then tractor rollovers. Financial stress has historically been reported as a leading factor in completing suicide. Financial loss and depressive symptoms are characteristics of individuals experiencing suicidal ideation. So we find a high percentage of people who are suicidal are depressed. Another problem is that difficulty with money has been reported as one of the leading causes of marital stress and divorce. So if we have financial problems, it's likely that our spouse and we are going to be arguing about it. Increasing debt contributes to negative marital quality. Higher rates of suicide among farmers and ranchers have been reported in the United Kingdom, Australia, Canada, Scotland, and the U.S., particularly in the United Kingdom during the foot and mouth disease outbreak of some years back. There was a real spike in farm and ranch suicides. Well, this slide shows the latest statistics that are available in terms of suicide rates by state. And if you take a set of data like the 50 states suicide rates and cut it into 4 parts, those are called quartiles. And so you have the top quartile, in this case they're colored red, and the second quartile, which is colored blue, and then third quartile, which is gray, and the fourth quartile, which is white. So the fourth quartile are those with the lowest suicide rates in 2010. What you see, I have slides back here for about 15 or 20 years. And what you see is that consistently in the western mountain states, including Alaska, that the suicide rates are often, if not almost always, among the top quartile, from Montana down to Nevada and Arizona. Then the other states, different states will be in the top quartile in different years. It just kind of varies depending on economic situations and other situations. Western mountain states have the highest suicide death rates. The risk of suicide death increases among older men and is especially high for 75 years plus, especially if they lose their spouse in their dairy or farm. Most are white and not married. I'll tell you just one experience. When I was giving a workshop in one setting, a man came up to me at the break and said, "I'd like to tell you my story." And I said, "I'm listening, I'd like to hear." And he said, "Well, I had this friend for maybe 30 years, and I had wondered what had happened to him, and the next day I saw in the paper an obituary for him. So I called another friend and asked him what happened. And he said, 'Well, don't you know?' And he says, 'No.' And he says, 'Well, he lost his wife 2 years ago, and then he lost his farm recently. And so he went into a gun shop and he asked for a handgun, and he bought a handgun. And then the young 21-year-old who was selling the guns there said, 'Well, you want to buy a box of shells?' He says, 'No, I only need one.' And the guy said, 'Well, I can't sell you a whole box. I can't sell you one shell. You've got to buy a whole box.' That should have been a tip-off to the guy not to sell it to him, because if you're just going to buy one shell, you've got a pretty good hunch about what he's going to do with that. So anyway, this guy was over 75. He had lost his wife and lost his farm. And many men, when they lose their sense of identity and of who I am, and he no longer was a farmer and a husband, and he saw only one way out, and that was suicide. This slide is an older suicide, but I like it because of what it shows us demographically. What you see at the bottom horizontal line is the suicide rate for African American women. And you see they spike at about 2 per 100,000 at age 20 to 24, and they spike again at 40 to 44 and have a few bumps along the way. White women peak at 45 to 49, and every workshop I've given, I've asked women why they think it peaks there, and they tell me probably because of menopause as well as empty nest. African American men peak at about 18 or 19 per 100,000, age 25, and age 70 and 74. Now look at white men. Here's where your biggest risk is, where you see white men, when they get to be 75 to 79, they have a suicide rate of 40 per 100,000 and goes up to 56 per 100,000. Now let's look at the next slide because it has more updated statistics on it. There you see that the white male's suicide rate is about 52 per 100,000 once you get to age above 85. So we need to pay attention to that. The overall suicide rate in the U.S. was 12.4 in 2010. That's down here, 12.10, just above 10 on this graph. And now I'm going to quote from Newsweek, a recent article in the April 10th issue of Newsweek. If you haven't seen that article, I surely do recommend it to you. My friend and colleague Mike Roseman was quoted extensively in there in terms of his good work with suicidal people, especially with farmers and ranchers. And here's a quote from that article. Since the crisis of the 1980s farm crisis, the suicide rate for male farmers has remained high, just under 2 times that of the general population. Now that would be at about 28 to 30 per 100,000, right in this range here, which is a little over twice as high as a little under twice as high as the national average. Now, what I want to mention about the veterans' rate of suicide as well. Records from 48 states show that the annual suicide rate among veterans is about 30 for every 100,000 of the population, compared to a civilian rate of about 12 per 100,000. And it has risen 2.6% a year from 2005 to 2011. Well, the question is, why do farmers and ranchers commit suicide at higher rates? Well, the good news is it's not increased levels of mental health issues. Farmers and ranchers don't have a higher rate of mental health issues than do others. It may have to do with demands of family farms, the culture of farming communities, the shortage of healthcare professionals in rural farming communities, high accessibility to firearms, occupational stress, financial difficulties, family problems, and of course retirement is a very trying transition for farmers. When we've looked at trying to figure out why is it that 3 out of 4 suicides in the United States are committed by men and only 1 out of 4 are committed by women in the US versus in China where 2 out of 3 suicides are committed by women and 1 out of 3 are committed by men, we think it may have to do with some messages we get when we're little boys, as we're growing up and as we're adolescents and as we're men. David and Brannon came up with the first 4, that we raise our boys differently than we raise our little girls. We'd say our little boys, no sissy stuff. Men are expected to distance themselves from anything feminine. Be a big wheel. Men should be occupationally or financially successful. Be a sturdy oak. Men should be confident and self-reliant. Give them hell. Men should do what is necessary to make it. And I've added a 5th one to this based on my 35 years of working with farmers and ranchers in Colorado and Wyoming and Kentucky and Texas. When you're hurting, be a man. Keep it inside and tell no one. That seems to be a message that many men have. And they're much more vulnerable. I think it's striking that in our list of participants today, now I haven't checked lately because I've been presenting, but the last time I checked, about 2 out of 3 participants today are female and about 1 out of 3 are male, assuming that the names are associated with gender. I think what that has to do with, in my workshops, when I have men and women there, women seem more tuned in generally in our culture to signs of depression and suicide, and they seem to be more tuned in to that kind of thing. So when they see that in their spouses or a brother or a father, they will know what signs to look for, as Shai will talk more about later, and they can be helpful people to get the guy who commits 3 out of 4 suicides in Colorado and the U.S. committed by men, to get him to professional help. So being an older white male with risk increasing with age, that a half of the suicide deaths are by white males 35 years plus. Work problems and unemployment are very much associated with this. And I want to share some facts about veteran suicide as my last slide before I turn it over to my colleague. 30 to 32,000 U.S. deaths from suicide are happening each year. 20% are veterans. 18 deaths from suicide are happening per day with veterans. There's no evidence for increased rates in OEF or OIF veterans relative to gender, age, race, matched people in the population as a whole. Veterans are more likely to use firearms as a means. So these are some of the things we need to be aware of as we work with our clients, as we work with people that might be at risk. At this point now, I want to turn it over to my colleague, Shai Lewis.
Hi, I'm just working on getting my webcam started. Okay, so I think we are going now. I just wanted to give you a little bit more background about myself and my experience working in suicide intervention. Some of it was in the notice for today's webinar, but just to let you know where I'm coming from with experience-wise, I've been working for Suicide Hotline Services since 1989. I currently direct the operations at the Goodwill of the Finger Lakes 211 Lifeline program, which is an accredited information and referral and crisis center. We operate regional crisis services and information services in the Finger Lakes area of New York, but we also serve as an answering point for the National Suicide Prevention Lifeline. And through our relationship with the National Suicide Prevention Lifeline, we operate nationally as a backup center to the National Veterans Crisis Line. We handle calls from veterans and their families from all over the country. We also operate national live crisis chat services where people can instant message through their computer. They try sometimes from their smartphones, and it doesn't work out as well as we'd like it to. But we operate those national chat services. We do that for the general public through the National Suicide Prevention Lifeline webpage. We also do that with targeted online crisis chat services to users of Facebook who've been identified as at risk of suicide. And we also back up the Veterans Crisis Line chat program. For my background, I have a master's degree in counseling from St. Lawrence University, and I am an ASSIST, which stands for Applied Suicide Intervention Skills Training. I'm a master trainer through Living Works. I am a member of the National Suicide Prevention Lifeline Steering Committee, the National Association of Crisis Center Directors, and a board member of AIRS, the Alliance of Information and Referral Systems. I wanted you to know all that information to let you know that I have a lot of experience to share, and the most important thing that I want to share is that it's not that hard to help someone at risk of suicide. And I want to give you some very specific tools today to be able, as a person who maybe doesn't have a specialty in counseling people at risk of suicide, to know that you can still reach out, that there are things that you can do, and that there are ways to recognize and be appropriately supportive and help connect that person to other resources. The information I'm going to share with you today is really just a brief primer. It's certainly not everything that you could learn about working with someone at risk of suicide. The materials are based on my training, research in the field of suicidology, and based on my experience working with suicidal individuals. The concepts that I'm going to present are pretty universal to those of us who work in suicide prevention. but some of the specific lingo is part of the ASSIST model of intervention. And I highly encourage anyone who's interested in seeking out a local 2-day training in your area for that ASSIST program. You can Google LivingWorks to find information and get a list of any trainings that are happening in your area. There's also other really good gatekeeper training like the QPR model. And if you wanted to search that in Google QPR Institute, and you'll find information about some of those types of training programs if you're interested in learning more after this webinar. The most important thing, regardless of training and helping a person who's at risk of suicide, is really your willingness to look for signs of concern and your willingness to talk openly and honestly with a person at risk. So we're going to talk about what that looks like right now and move into, move into some of this information. So how do you recognize suicide risk? Bob gave you some good information and really helpful information based on the populations that you might be working with, who might be at risk of suicide. We learned a lot of things about people who live in rural communities, people who work in agriculture, veterans, older white males who have been shown statistically to be more at risk of suicide. But I also want to point out that it's important to remember that anyone could be at risk of suicide, and that includes those of us who are signed in today on this webinar. At some point in time, we could find ourselves in circumstances where things are really tough, where through a combination of predisposition, through various factors, and life circumstances, losses that we face, we could be at risk of suicide. All of those statistics are incredibly helpful to us in prevention efforts, knowing who to target early intervention efforts towards. They're very helpful to get us thinking about the people that we're working with and if they fall into any of those categories. But also don't put people in boxes to think that people are only suicidal if they're in one of these categories that we talked about, because people aren't statistics. And so think about maybe not the farmer or the veteran that you're working with, but think about their wife, think about a child, think about someone else in that family who could potentially be at risk that you're coming into contact with, who might not fit one of those groups. And how do you know? How are you going to recognize that? How can you tell that somebody's thinking about suicide? We talk about the concept of invitations. People who are at risk are going to give you an invitation to talk. Sometimes those invitations are very conscious. Somebody might say, I'm thinking about suicide. But sometimes the invitations are more unconscious. They are maybe something that the person isn't even aware of. But there's some kind of signal that the person at risk is distressed. And those signals are going to be an invitation to you to explore further whether suicide's on their mind. Sometimes, again, it's very overt. I wish I could go to sleep and never wake up. Those are things that somebody who's thinking about suicide might say to you. That's a more overt statement. There are more subtle invitations that we can think about. Giving away possessions. Some of those types of things could be happening. Excuse me. So those invitations could come in more subtle forms. They could come in a way that maybe only a specific person would recognize. Sometimes those invitations can be physical changes in behavior. You might see a change in a person's physical appearance. They're taking care of their hygiene. Sometimes you might see a person who's very social become more isolated. Sometimes you might see a person who is acting out and taking more risks. Again, that happens. Lots of people take risks. We're not going to assume that everyone who bungee jumps or everyone who's a loner is thinking about suicide, but we are going to look for it if it's a change in behavior. So look for things that a person might be doing, saying, how they might be acting that would help you to think something's different, something's going on here. And then the key to knowing if it has anything to do with suicide is really exploring that risk. Be respectful and sincere, but approach and say what you see. Too many times, those of us we're worried about opening a door. that we don't know how to go through, finding out information that we don't feel like we have the tools to take the person to the next step. So that's what we want to do today, is give you those tools. And the first step is to be respectful, to be sincere, and ask about what's concerning you. Tell the person what you saw or what they said that was concerning. You know, Bob, when you said that you sometimes wish that you could just go to sleep and never wake up, that makes me very concerned about you. And I'm wondering if you're thinking about suicide, or I wonder what's going on with you. You can just start that way. You don't even have to ask about suicide right away. And then listen to what Bob says in response to why he's feeling that way. Ask open-ended questions to hear more of the story. An open-ended question is a question that can't be answered with a yes or no. Be interested, be genuine, want to know what's going on for that person without offering too many solutions. You can use what are called reflective statements. You can say, it sounds like you're feeling pretty lonely. It sounds like you're feeling pretty isolated. I hear how you're feeling hopeless. If you're hearing those kinds of things and the person at risk is agreeing with you, and you're hearing those direct statements, the next step is to really ask directly. The person might say something direct about suicide, or if you're getting that indication that the person is feeling hopeless, they're feeling helpless about their situation. They have had some of these significant losses that Bob talked about. Any kind of loss can be a trigger. Again, many people who have significant losses in their life don't think about suicide. But if you're getting that loss in combination with a sense of hopelessness, helplessness, inability to change the situation, we need to ask about suicide. The best way to ask about suicide is directly. Let me tell you right now, you are not going to put the thought of suicide in anyone's head by asking. That simply does not happen. The thought is probably already there. A person might have evaluated the thought of suicide and already decided, no, that's not an option for me. And the best way to find out is to ask. And if the person is considering suicide as a way to deal with their distress, as a way to deal with the pain that they're feeling, the best way to find out is to ask. So we need to ask, and we need to ask directly. We need to ask with context if possible as well. So if you can say something along the lines of, you know, a lot of people who've experienced losses like these that you're facing and are feeling really hopeless about things ever changing, start to think about suicide. Is that something that you're thinking about? It helps to normalize and validate that suicide is a thought that other people think. A lot of people who are thinking about suicide feel like they're the only one, or feel like they're isolated, or feel like no one could possibly understand. So to ask directly about suicide, giving it that context, helps the person who's at risk understand that you are ready to talk about it and that you get how a person could come to be feeling that way. It doesn't mean that you support them doing it, but it shows your understanding. So it's very important to be able to ask that. Ask it concretely. Are you thinking about suicide? Are you thinking about killing yourself? Are you thinking about ending your life? Be careful about asking the question about suicide in a way that indicates you don't want to know the answer. You're not thinking about suicide, are you? That's not a good way to ask that question. So please be careful about that. Or you're not thinking about doing something stupid, are you? Those are well-meaning intentions and ways of asking that I have heard, but please be careful to do that. It's much better to just ask directly and with that context. People remarkably do not lie if they feel that you care about them when you ask that question. People tell you the truth. And it helps you to determine what next steps you need to take. Because a person who answers no to that question still might need additional help, services, linkages that you can take for them. And a person who answers yes, that gives you a specific course of action for what you would need to do to be helpful to them. And what you would need to do is start by listening. Open that door again and really listen to what the person has to say. Ask to hear about what brought them to that place, what brought them to be feeling this pain, and validate their feelings. Again, validating someone's pain, saying something like, I hear how all of these losses have led you to think that suicide might be an option. It doesn't mean that you validate them acting on any thoughts of suicide, but you're validating the pain that they might be feeling. When you're listening, be careful not to rush too quickly to trying to fix it. Really spend some time listening to what the person has to say about where they got to. You don't have to be a therapist. You don't have to be a counselor. We're not talking about that kind of listening at all. What we're really talking about is hearing their pain. For a lot of people, just telling their story is a huge sense of relief and helps to diminish some of the negative feelings. It doesn't solve everything, but being heard is a major part of that. Some people have been keeping these thoughts and feelings inside. As you're listening, please be careful not to judge or to minimize, to say things like, it's going to get better. You have to hope, I promise. I promise things will get better. Those kinds of statements are difficult because you don't know that. Resist the urge to say things like suicide is a permanent solution to a temporary problem. A lot of us have heard that kind of statement, and it's a dangerous statement because for some people, a mental health concern is an ongoing concern that they'll be dealing with their whole life, or the loss that they're facing, the grief that they might be feeling might be something that's going to stick with them for quite some time, or even always. We're hoping we could give them some tools so that they can better cope with that grief, but it's minimizing and disrupts your connection to the person at risk and the likelihood that they will be connected to other help if you minimize like that, or rush a person through to a solution, telling them all the answers right away, or telling them all the reasons that they have to live. You get to do that, just not yet. Right here, spend some time just really listening, using those reflective statements, hearing the story. Let the person tell you why they want to die. As they are telling you why they want to die, why they want to end their life, listen for ambivalence. Listen for that person's not being 100% sure. You might hear a but. I really think that there's no other solution but suicide, but I'm worried about my pets. I'm worried about my children. But what will happen to? That but is the part of the person that wants to live talking. And we need to listen for that but. We need to listen for that ambivalence, or what we might call a turning point, when they start bringing that up. It's so much more powerful when the person at risk finds their own ambivalence and you reflect it back to them than it is for you to tell the person that you need to stay alive for your children. You need to stay alive because you have these things that could happen. It's much more powerful for the person to uncover them as they're telling their story. That ambivalence will naturally begin to come out. And then you can point it out to them and explore those reasons to live. So it sounds like your pets are really important to you, or it sounds like you really would like to be here to see your children grow up if you could, you just don't know how right now. Or it sounds like it's not so much that you want to die, but that you don't know any other way for the pain to end. If we could talk about ways for the pain to end, would you be willing to try to stay alive? Would you be willing to try to stay safe? And so as you hear those things, point that out, reflect it back, and then work together to create a safety plan with the person at risk. A safety plan isn't complicated. It's very simple. It has some easy steps that we're going to talk about in just a moment. A safety plan isn't you telling the person who is struggling what to do, because it won't work as effectively if it's not a collaborative plan. We want it to be directed by the person at risk whenever possible so that it's their plan and you help guide it. And again, it's very simple. It's not too many elements. Let's take a look at what they are in just a second, because I also want to stop and say that your safety plan should address any risks. As you're creating that safety plan, think about what you know from what they've already told you in their story. Do they tell you that they have a current suicide plan? Are they thinking about using a firearm? Do they have a history of suicide attempts? Do they have a lack of resources or supports? Is there a diagnosed known mental health concern? If you don't know about these risks already, just by listening, this is the part where you can ask after you have that agreement. So it's not so much that you want to die, it's that you are in incredible pain. And if we could create a plan to help you deal with some of that pain, you would want to stay alive. And the person will usually say yes. And at that point, you can move together and say, well, let's talk about what that plan would look like. And then you can ask about some of those risk elements. And while you are creating the safety plan, you can address those risk elements through these 6 steps. The first thing that you want to talk about is any triggers or warning signs. And it's super helpful if you can write this down if you're face-to-face, or if you're working with somebody remotely, if you can get them to write this down. Have them think about what are their triggers or warning signs. Are there any events or feelings that trigger that person to having thoughts of suicide, or having those thoughts of suicide feel more intense, like they might act on them. A lot of people think about suicide in the back of their minds quite a lot, but there are triggers or other things that happen, any feelings that they know where those, the likelihood of acting on the thoughts of suicide could become more intense. If the person can identify those, then they can plan for them. Maybe avoiding a specific event or situation that is triggering, or maybe practicing ahead of time some calming techniques for a particular emotion. Like maybe they know that a fight with a spouse is a trigger. Maybe they know when it's the time to pay the monthly bills, that's a trigger, and they can figure out a different strategy for how to handle those things to be less triggering, to be more mindful in their planning to handle those events and feelings. Then you can explore internal coping strategies. And internal coping strategies is a fancy way really to just talk about the activities that help us address negative feelings. What helps us feel better? What helps you feel better might be what helps the person that you're working with feel better. So we can talk about just general strategies. What are some things that you can do to cope? A lot of people find exercise really helpful. If you're working with a person who's able-bodied and can do some kind of physical exercise, that can be incredibly helpful. Some people like to write in a journal. Other people like to take a long walk, take a hot shower. There are all different kinds of internal coping strategies that people can use to try to feel calmer. If you think about a terrible day that you've had, when you come home frustrated, angry, distressed, depressed, whatever those feelings might be, how do you cope with that? What do you do to de-stress? What do you do to cope with negative feelings? And that you can brainstorm with the person around some internal coping strategies. And as a safety plan, you can ask them to write those things down and have that maybe on a piece of paper in their wallet, in their back pocket, that they're going to pull this out and think about, did I just have a triggering event? What are the internal coping strategies that I can use? You also want to ask them to think about who are their social contacts that can distract them from the feeling, the crisis. Distraction is an important element in staying safe. How can we distance ourselves from these thoughts? If all we do to try to solve our suicidal thoughts is distraction, it's not a good long-term solution, but it's a tool to have in our toolkit. So what can you do that's going to make you feel happier? Is there anything that you can do, any people that you can be with that are positive influences and that you can spend time with? Maybe you don't want to disclose to them that you're thinking about suicide, but you could call that person up and you could go bowling, you could go watch a movie, you could have them over for a cup of coffee and just enjoy spending time with that person. There's a lot of value to distraction in helping to keep you safe. So have that person write those things down in their safety plan as well, those social contacts. We should also identify family members, friends, who's in the support network for the person who might be at risk. Identify those connections. Talk to them about finding someone else they can tell. A lot of people, and we talked earlier with Bob's slides about keeping it to yourself, especially with men not being willing to share. And it's across the board with men and women. When it comes to talking about suicide, it's really difficult to tell that to someone else. And maybe you're the first person because you picked up on those warning signs, you picked up on those invitations. You might be the first person that they've told. So how can we bring other people into the supportive circle who know what's at stake? Could it be a spouse? Could it be a friend? Could it be a coworker? Who is it that that person trusts and would be willing to bring in and say, could you be my safety contact if things get rough? Could you be somebody that I call? I'm going through this right now and I'd like to lean on you for a little bit of help. An important element of safety planning is identifying those safety contacts. If the person has absolutely no safety contacts, we can move on to the next step of identifying professionals or agencies that they can contact for help. Really important to think about. So you in your own communities can be aware of the agencies or resources that are available, what service they offer, or what their limitations are. As you are talking to the person who's at risk, you can listen for signs and symptoms that you might need to get them connected with services. It shouldn't always be mental health services. Sometimes the services that they need are financial services, legal services, personal services that can help them deal with specific issues that they're facing, as well as those mental health services. As you're identifying what agency or community resource would be appropriate to address the person's problems, you can write those down and put those on the safety plan. If you don't know what resources they need, you don't have access to them, that's not in your personal listing, what you can do is think about using 211. That's an agency that I work for, but there are 211s that cover over 90% of the country in terms of population at this point in time. And they provide information referral about all kinds of health and human services information. You can reach out to 211 in your community, and I'll tell you how to do that in the next slide. You can also call the National Suicide Prevention Lifeline. That's a great place to start. It will route a caller to a network of over 160 crisis centers throughout the country. So you can dial that national number, and it will get you to the closest certified crisis line in your part of the country. And those two resources, 211 and the National Suicide Prevention Lifeline, know a lot about the human service system within their given communities and can help you navigate to where resources are available that might be outside the bounds of your knowledge. You can discuss the referral with the person or their family member, thinking about making that referral. It sounds like you're feeling really depressed. I'd like to connect you with some counseling services that I'm aware of, or help you connect with some resources. And you can introduce resources in that way. You could have them write them down, make calls, maybe with you there, or if they're going to make the calls on their own and you feel confident to have them do that, plan any barriers to connecting with the resources. Maybe someone's not able to get away from their work duties in order to make those calls. Talk about what that's going to look like. When are you going to call? And help see past barriers, because it's really hard to take that step and make the next call that you might need to make as a person who's at risk. And any little barrier is easy to go, see, it's not going to work, and put that down and not make the call, not follow up. So help the person to plan around potential barriers that they see, address it up front, and also make a plan to follow up with the person at risk on the resources or referrals that you're giving to them. Also ask to think about making the environment more safe. The safety of the environment is really important. Talk to people about guns that they have in the home. Ask them what they think they can do about that if a gun has come up as a potential plan or potential risk. Ask people what they're going to do about pills. People need those pills sometimes to control blood pressure, or to control diabetes, or to control other illnesses. Could someone hang on to pills if pills are a risk? Could we get rid of the rope if they've already tied a noose? Can we reduce access to the gun? Basically, think about it as a continuum and try to put as many steps between the person and their plan as possible when we're making the environment more safe. So if they aren't willing to give their gun to someone else, you can also ask them to put a gun lock on, to separate the gun and the bullets, to put a gun lock on their gun. There's a lot of different things that we can do. You can collaborate with the person on that around making their environment safer from any particular method. And we can involve family with that as well, and those safety contexts that we already talked about. Just a couple of things in case you wanted to write it down, specifically on the finding 211s or finding the National Suicide Prevention Lifeline. So I've given the website for the 211 locator. You can put in your zip code, your city, your state, a variety of information in order to retrieve the closest center to you. You can dial the National Suicide Prevention Lifeline, which is also the gateway to the Veterans Crisis Line. If you press 1, it will take you to the Veterans Crisis Line. If you don't press 1, it will route you to the center that's geographically closest to the phone number that you dial. And you can also have people who might be comfortable, especially younger people, but we receive chats from people from age 10 to age 80 through suicidepreventionlifeline.org. There's a chat page that you can go to there. I also want to talk about those circumstances that may not be going so well, that you may come into contact with. When are you going to involve emergency services? When might be time to notify EMS that we need someone out there to assist with a situation that is imminent risk or already in progress? So think about asking if a person tells you that they've been thinking about suicide. Maybe you'll hear signs if they sound slurred. It could be a sign of drinking. It could be a sign of complications from a medication, but it could also be a sign that maybe they've already taken pills. If they've told you that they're thinking about suicide, you might want to ask if they've already made an attempt. Or you may come onto scene if you visit with people face to face and find someone who is has already taken pills or has already taken some other action to harm themselves or end their life. Or if you hear somebody who's talking to you about what we call imminent risk, they have a specific lethal available plan, and there's a timeline on that plan that's in the near future, you are probably going to need to involve somebody outside yourself. You can contact emergency services by dialing 911, or if you feel like you're just not sure which way to go with it, if you're not sure it's imminent, you're not sure it's an emergency, call that 1-800-SUICIDE number or 1-800-273-TALK number for the National Suicide Prevention Lifeline yourself, and consult with one of the counselors that answers the phone and make that decision together about when to involve emergency services. You're not alone in coming into contact with a person who is at risk, and there are folks who are going to help you to talk through what you're seeing and give you some coaching and guidance as a person who cares about someone at risk. Other times that you may need to involve emergency services is when that person is unwilling or unable to collaborate for their own safety. Perhaps there's a cognitive issue, or they're so despondent that they are really unable to cooperate or give you much information in the plan. You're going to need to involve somebody else, an emergency service of some kind. Ultimately, these are just a few tools so that we could use to get you started on having a conversation. It's really important for you to make those linkages for folks, and we really want to have you focus on the concept of responsibility and your role in working with a person at risk. It's really important to remember that ultimately you can only be responsible to the people that you're serving and care about, or that you come into contact with, but you cannot be responsible for them. So ultimately, we can only be responsible to the person. Be careful about feeling like you have to save someone or take responsibility for their safety. You alone can't do that. Please seek help for yourself if you're feeling overwhelmed with trying to help. Remember to have appropriate boundaries within your role and make sure to pass them off to the next caregiver. You can identify, explore, ask about suicide, and make a caring linkage to another qualified individual. You don't have to do it alone. There are folks that you can talk to at the hotline. Your community may have a mobile crisis team or other ways to get people right out on scene to see someone who is at risk. So you can reach out for help to help somebody who is at risk. And so that's the last thought that I wanted to share, and it's an important one. If you are going to start taking steps to be more active in identifying people who might be at risk of suicide, being more open to talking about it, being more willing and able to start those conversations that are really hard and scary for a lot of us. So I hope that those are some tools that can help you. I could talk for days about it, but I want to be mindful of our time and open the floor to questions. Please remember to be careful out there and to take good care of yourselves while you're doing this work. Now I'm going to turn it back to Paul, and he will take over from there. Thanks.
Thank you very much to both Shai and Bob for that excellent information you've provided. While we're assembling questions, please feel free to go ahead and type any more questions that you have into the chat window. And remember, if you do want to ask a question verbally, just click on the raise hand icon at the top of your screen, and we will enable your microphone so that you have that capability. While we're waiting for questions, we will go ahead and do our 4 quick polls. The first one simply asks about your professional affiliation. If you could let us know what background you have professionally, or if you're attending as a consumer or a farmer or veteran, that would be very helpful to us. And you can scroll down on that and find the one that's most applicable to you. We realize that you may have several different hats that you wear, but just try to pick the one that's most relevant to why you were joining the webinar today. Stretch that a little bit bigger so we can see that. Okay, we appreciate your input, and that's how it looks for today. Our next question asks about the information that was shared today. If you could tell us if you found the information to be helpful and if it met your expectations. Give you just a couple more seconds on that. Okay, thank you for your input. And there are the results from that poll. Next question asks about the technology. And so we're wanting to know if you found the technology today to be usable, and effective. If you had any specific problems, it would be helpful to know that, and please go ahead and type that in the chat window if you could give us any areas where it would be helpful for us to improve that. Sound like some people lost their audio at some point. Okay, we'll give you another second or two on that. Okay, and the results from that poll today. And finally, our last question. Based on today's session, I would attend another session in this series. If you could let us know your opinion on that, we'd appreciate that. Okay. And the results for that. Okay. So, let's see, Cliff, do we have any questions at this point? Okay, I will go ahead and disconnect my camera and microphone, and Bob and Shai can come back on and answer these questions as they feel they are qualified to do so. Bob, are you going to try to answer this one?
I don't see the question.
Should be right in the middle of your...
Center of my screen is black. Oh, there. What do you do when you ask someone about suicidal feelings and the person is concerned about losing insurance coverage, job standing, or being threatened in court? I think first of all, what I would do in a situation like that is hear them, tell them, sounds like you're really worried about what may happen with your insurance and that you may lose your job and that something's happening in court. First of all, make sure that I connect with them to let them know that I hear them. Then I would ask about, have you inquired into getting a good attorney for yourself? Well, you've got someone that can help you in a court situation. And have you talked with an insurance agent about your coverage? Is there an HR, human relations person that you might trust in your job that might be able to assist you in your job situation? I'd look for ways in which they might have resources that they may not have thought about before. Shai, would you want to add anything to this question?
Um, no, I don't think, I think you did a great job in thinking about that. I think when we, and I'm sorry I can't get my camera on just yet, but when we talk to somebody who is worried about these things, one, those connections to other community resources to deal with some of those threats is really important, as well as weighing the balance between those fear of reaching out because of those fears versus dying by suicide, and weighing the balance and taking that risk and helping that person to take that risk, if that makes sense.
Shai, do you want to pick up on that next question?
I'm not sure if anyone can hear me. I'm having a little bit of difficulty with the computer. Whenever I mute the microphone, it slows everything down for a minute or two.
We can hear you.
Was anyone able to hear me?
Yes, we can hear you.
Okay, fantastic. So is there any recommended difference in approach between various age groups of individuals? With most adults over the age of 25 or so, there's really not a ton of difference, in my opinion, in your approach, besides being respectful, open, empathetic. Sometimes working with young people, I've found it's really important to be a little bit more directive. Young people under the age of 25, usually under the age of 20, aren't as in touch with talking about emotions or feelings, and they're really looking more for direction, guidance, and advice. So while still being empowering and trying to encourage choice as much as possible, we are also looking to do that in a context that's a little bit more directed problem solving with younger folks. They're not as used to sort of exploring options and thinking about things in that way. Bob, does that meet with your agreement in terms of how you interact with folks, or any other additional to share?
Yes, I think that's a good answer to that good question.
And Shai, your audio was breaking up a little bit on that. I just wanted to clarify that you were saying that you need to be more directive with younger people than with older people. Is that correct?
I'm sorry, say again, I missed the first part of the question.
Sounds like we're having a little bit of audio problem with Shai at this point.
Yes, I'm sorry.
I was just saying that your audio was splitting up a little bit, and I wanted to clarify that. You were saying that you need to be more directive with younger people.
Yes,
Okay.
that's what I was saying. A little bit more directive, still offering empowerment and choice, and encouraging that person to think a little.
Okay, the next question I see here is the data on farmers. Was that a region?
So Shai, it sounds like possibly that we're having problems with your camera being on, so it may be interfering with your audio. If you want to go ahead and turn your camera off, that might improve our audio a little bit, so I'll help you do that. There we go. Okay, Bob, now you can go back to your response on the other question.
Okay, the question is the data on farmers. Was there a region that was the highest, I assume, and highest in suicide rates? I haven't found that data. If it exists, I'm not sure where to find it, that one region is worse for farmers and ranchers with suicide rates. What we can predict is that there will be a relationship between tough times or economic hard times and suicide, depression and suicide. Those are highly related. So I would just speculate here, not having good data yet, because the data reports lag a bit before they get reported to the states and then to the federal level, etc. But with the current severe drought that exists in California and parts of New Mexico and Arizona and parts of Colorado, it's likely that those kinds of places, particularly as hay gets harder to find, or as it gets harder to have enough water to produce the crops, etc., because of the irrigation being shut down, those kind of places where stress gets higher on a broad base in a region because of drought or because of flooding or because of fires or because of severe problems that go on, that's where I would suggest you keep your eyes and ears open for possibilities of people feeling hopeless and feeling like they don't have any other choice than to take their lives. So I'm sorry, no, I haven't found any data that looks at regional deaths, suicidal deaths for farmers and ranchers. But if we just watch for where is the highest stress point in terms of a region, that can give us a pretty good picture about where we can look. Are there therapy resources that a person can turn to after therapy sessions exceeds what insurance will pay for? Yes, of course. Many counties across the nation have mental health resources and mental health centers, and all of them that I know of are committed to providing a sliding scale, so that if financially paying for the mental health services and the counseling and the therapy sessions is a difficult problem, you might pick up the phone and check with your local mental health services or the ones in the next county and ask them what the rate would be. You might be able to negotiate a lower rate so that you don't have to pay so much for a therapy session. Shai, would you want to add to that, what I had said there?
Yes, I agree that we want to investigate low cost or sliding scale fees that are available. Contact the 211 center or the local crisis lines, and that's a great way to find out as well about therapists who maybe are doing pastoral counseling or other kinds of free counseling that's available as well. So there's low cost, sliding fee scale, and then there are some free services. It depends, and it is very difficult in rural areas to find those services, but they do exist in certain places, and it's worth looking. It's worth not giving up and taking a look for those services and doing an investigation. So we hope that you're able to connect with some of the resources and try to find that out. It is possible. I'll chime in on this one and mention that there's some really great online resources through the Suicide Prevention Resource Center. So if you look that up, Suicide Prevention Resource Center, or the American Association of Suicidology. They both have some great programs that are out there. There's a free training right now that we're looking at called CALM, Counseling on Access to Lethal Means, which is really powerful and available through the SPRC. for free. And there's also wonderful resources on the American Foundation for Suicide Prevention. There's a lot of valuable information there that would help you continue your learning.
I would just add that one of our previous AgrAbility webinars dealt with mental health specifically related to drought issues, but a lot of those principles that were presented in that webinar would be relevant to anyone dealing with mental health issues, including suicide. So you might want to check that out on the archive page on the AgrAbility website. Bob, did you have anything else you would like to add there?
No, I think Shai did a wonderful job of answering those with question with those resources that are available. Looks like Dale Garrow has a good suggestion there, saying the National Alliance on Mental Illness has also great educational sessions on intervention and prevention training. Thank you, Dale, for providing that. I just want to say one last thing to all of you that have been on this webinar. I'm glad you took the time to be with us today and to be interested. I want to tell you it's important that you take good care of yourself, because if you don't take good care of yourself, nobody will. And if you don't take care of yourself, you won't have what it takes to be able to provide the careful, sensitive, respectful listening that Shai did such a wonderful job of describing today and modeling in what she taught us today. So take good care of yourself, because as you do that, you will be better able to respond well, to be responsible to the people that are suffering in your area.
Thanks, Bob.
Thank you again to our presenters today
And
to
now we'll
all
turn it
those that
back to Paul.
participated in the webinar. You will find the address for the archives up on your screen, hopefully at this point. And feel free to, I think we'll have the presentation and the recording up there along with the transcript within the next couple days if you'd like to refer back to that. I will point out also our next AgrAbility webinar is scheduled for July 23rd at 3 p.m. Eastern Daylight Time. And the topic for that session will be significantly different than this one. It will involve technology for improving vision while using farming equipment. And that could be for somebody that has a visual impairment or someone who has difficulty turning and looking, for example, behind them, or just anybody that's using large equipment that would benefit from things like backup cameras and mirrors and other types of video devices that can improve one's ability to see while operating, especially large farming equipment. Again, if you have any comments or questions, feel free to leave those in the chat window. The room will be open here for a little while, or just email us via the AgrAbility@agrability.org website. Thank you again for participating, and have a good day.